Good afternoon. Welcome to the daily briefing here at the County EMA office, joined by Chairman Mark Kern and, of course, our numbers lady, Sam Bierman from the Health Department. More numbers today.
More numbers today, as always. So as of today, the numbers that we will report to you are St. Clair County residents that have been tested. And for today's numbers, we have 1,780 St. Clair County residents that have been tested. 404 positive test results, which is an increase of 15 from yesterday, and that includes both males and females from teens up to the 90s. We have 1,347 negative test results, with 29 test results still pending. And I do have some sad news to report today. We are adding one additional death, so we now are currently at 23, and that individual was a female in her 90s who did have underlying health conditions. And our thoughts and prayers and condolences go out to the family of that female. For state totals, we are at 227,628 that have been tested, with 45,883 positive test results, which is an increase of 1,983 from yesterday. And today we are reporting 1,983 deaths, which is an increase of 50 from yesterday. For our hospitalization numbers, we have 55 patients that are admitted due to COVID-related reasons, and quite a significant jump on patients that are on ventilators. Today we are reporting 12 patients on ventilators that are currently admitted to the hospital. For long-term care centers in St. Clair County that are considered outbreak status, and that means 2 or more staff or residents that either are COVID positive or have COVID-like symptoms. Brea of Belleville with 12 positive cases and 1 death. Colonnade of O'Fallon with 2 positive cases and no deaths. 4 Fountains in Belleville with 25 positive cases and 1 death. Memorial Care Center in Belleville with 15 positive cases and 1 death. St. Paul's Home in Belleville with 5 cases and no deaths. And Lebanon Care Center in Lebanon with 4 cases and no deaths. And now I will turn it over to Chairman Kern for his update.
Thank you, Sam. So we appreciate everybody continuing to be vigilant. The longer that we shelter in place, the more that we'll be able to stop the spread of this virus, and the less chance we have that it's going to come back in a second wave. But we are also balancing that with business interests, and certainly when there comes a time that the medical community feels that we can open to business, we certainly are going to do everything we can to make sure those businesses do reopen and that they'll be as successful or more successful because of pent-up demand in the future. We got a couple of good announcements today. The Illinois Department of Public Health issued new guidance today on testing, and they've loosened up the testing guidance in a big way. They're now saying that if you have COVID-19 symptoms, which is cough, shortness of breath, and fever, of course you can be tested. They used to also tie that to having contact with someone that had COVID or also having a compromised immune system. Now they've removed that, and they've said that if you have symptoms or if you have been in contact with someone confirmed to have COVID-19 or you have a compromised immune system or serious medical condition, you qualify for testing. So no longer are all those 3 tied together. Now they're separate, and they've all become separate reasons to get tested, and it's going to open up testing to a lot more people than there were in the past. So they'll be able to take care of the new or take advantage of the new testing sites that are available in St. Clair County, which have opened up, and certainly all those are listed on our page. If you have any questions, you certainly can go to the page and find out those locations. Also, another good opening up of services is with the regional mental health disaster team, who are counseling people that are having mental stresses, mental problems related to COVID-19. It was for our first responders, and now they've opened that to long-term care and assisted living staff. They're seeing a lot of stresses. As we've seen these numbers blow up in long-term care facilities in the area, along with that goes the workforce, and those people are there every day. They have many of them have developed loves and relationships with the patients that they are with every day. Many people in assisted living and in long-term care are have been there for quite a while, so those relationships form. It makes for a difficult environment when you see people that can no longer see their family, the restrictions that are there. So long-term care and assisted living staff, I think, have reason to use that. And so the number is 381-5173 to speak with a local trained mental health volunteer, and that service is open to long-term care and assisted living staff as well as first responders. So mental health is is an issue that we have to deal with. COVID-19 medically is an issue, and mentally it has taken a toll on our community. So today we are joined by Brent Cummins, Director of Adult Addiction Treatment and Recovery at Chestnut Health Systems. Welcome, Brent.
Thank you, Mark.
So Brent, let's just start with this. Have you seen an increase in the number of people needing assistance and treatment during this pandemic?
We certainly are. The concerns are really escalating, as we know. This issue is making a lot of us isolated in our homes. We're not able to get out in the community and connect. In our world of addiction treatment and recovery, the big thing that we stress is connection and getting out and meeting new people, connecting with people at 12-step meetings and things of that nature. A lot of those have been shut down, so they're having to find new methods, and there's methods related to phone and video that we've started to implement for support groups and our counseling methods, but we're concerned with this pandemic, as we've been treating an opioid epidemic, that things will continue to cause concern. Alcohol, for instance, is another example where, as a nation, a couple weeks ago, those sales were up 55% as a nation. So we're concerned that we might also see new people that develop substance use disorders through this pandemic, and we want people to know that we're available at Chestnut to assist as we can.
So people cope in different ways, and those addictions come back to haunt people that have recovered. Are you seeing that where people have been in recovery and then all of a sudden they've fallen back because now they're isolated?
Yeah, we've heard those concerns. We've also heard that people in long-term recovery are having concerns related to their recovery and are now hopefully reaching out to us to gain support and gain additional resources that we can provide. We've utilized some of our peer recovery specialists, so people with lived experience with addiction recovery, to help with some curbside deliveries of Narcan, which is something that helps people avoid overdose related to opioids. A variety of different ways. We've had to get very creative to help address this issue, given that social distancing guidelines and safety guidelines.
I would assume that if people are going to buy illegal drugs, that probably hasn't slowed.
It hasn't. No.
During this time. Are there so if someone has never been in for treatment before, things are getting so bad at home, maybe they're even forced to stay home, and so family members are seeing their issues with addiction they might not have known about before, if that's possible. What's available to people who are seeking treatment now?
Sure. So there's a variety of different ways. One of them is, they can call us directly at Chestnut at 618-877-4420. They can get connected through us and we can set up a phone assessment. We can do that by phone or video to help people get started with us and help identify what level of care they may need. It's important to know all of our levels of care are available to our clients at this point. So we have some local detox services available if those are needs. They can stay with us for detox, typically 3 to 5 days. We also have residential treatment up in Bloomington that we help assist individuals getting up there. We can help transport them up to assist them with that. We have a local peer recovery support specialist that's funded by our local 708 Mental Health Board. If I can provide you with information for him, and those individuals can reach out to someone that's in recovery themselves, and he can help sort of make sense of the treatment process and help people get connected to treatment, help people get to treatment. And the last thing is the Illinois Call for Calm text line that's now available. That's a great resource. If people just text HELP to 55020, they can get assistance from a local mental health provider in a variety of different areas. They can also text words like employment, housing, food to that text line, and somebody trained in those areas can help assist people with some of those underlying issues that often lead people to seek substances.
And so what is that text number again? Just so we have that, because that's a great
Yep,
service.
you text the word help to 55020, and that's the Illinois Department of Human Services text line that they opened up, and local mental health providers have been trained to help kind of navigate people to the resources we have locally.
So a lot of agencies have had to come up with ways to cope to protect their
Sure.
the people from COVID-19. Or you guys have taken those same precautions?
Absolutely, yeah. So in my world in outpatient addiction counseling, we're doing a lot of phone and video counseling at this point, utilizing some Zoom software. So we're seeing people face-to-face through video. We're doing that with our individual group and assessment processes. We also have some funding available to provide individuals with some web-based therapy. So they'll be able to log into a particular website through our system and complete some treatment modules through that with help of their addiction counselor. They can work through some of those issues through that. And then the 12-step meetings, a variety of them have converted to Zoom platforms as well for people to engage with people in their community that are in recovery from substance use disorders too.
If a person is going through withdrawal, maybe they, who knows, maybe whatever, their source dried up, or they lost the motivation to go out to try to get their substances.
Sure.
What resources are available? Do they certainly don't want to maybe go through withdrawal all
Right.
at the same time they're having mental stress. What services are available for a person like
the
that?
big one for us is our medication-assisted treatment processes. And so for someone who's in withdrawal from opioids or alcohol, we can provide them with medications called Vivitrol and Suboxone. And the great thing now that, it's hard to say it's a great thing, but through this epidemic or through this pandemic, they've lessened some of the federal guidelines related to how we can provide those services. So in a lot of situations, we can potentially start somebody through video from home, and people can start those medications to help reduce some of those withdrawal effects through that particular process. The individual would go through a screening process by phone. If they're a good candidate, we could potentially start what's called a home induction process to alleviate the fear or concern with people leaving their home and going to our treatment facility, which we understand and we're aware of that. So we've developed what we can in a virtual platform to help people get support and get help. With this process, about 10% of people with a substance use disorder actually get help. And one of the big reasons why they never do is because of transportation, because of stigma and things of that nature. So one of the things with this is an opportunity for us to potentially reach people in their home now, and also provide some good family counseling, because all of us are kind of together at this point. So it's a good opportunity for us to hopefully reach people and connect with people in a different way.
And there's no stigma involved. This is on an anonymous basis, or
Yeah.
at least certainly nothing's disclosed.
Sure. There's federal confidentiality guidelines in place. There won't be any information released without a written consent from someone. So that's a great point, and something that we continue to provide. We use HIPAA compliant software to provide our counseling services through the Zoom experience. So all of that is handled in a very confidential way. So people can hopefully, again, get help that they can get in a safe environment as we kind of navigate through this.
And some of those deliveries can be made to the home, so that they don't have to worry about getting out or
Yeah, so that's a good point as well. Our pharmacies that we have at Chestnut are through Genoa Pharmacy, and they developed some curbside delivery services, so people can call them and somebody will come out to their car as they arrive at our facility to provide them with that medication. Our recovery specialists have also started providing some curbside deliveries for things like Narcan and things like fentanyl testing strips at this point. There's a lot of people out in the community that might be using things like cocaine and methamphetamine and things that they may not think there's a risk for overdose, but so much of that out in the community now is laced with bad things like fentanyl and synthetic opioids that are killing people left and right. So we're providing them with that opportunity to reach out to us, and we can provide them with some fentanyl testing strips if they're at a point that they're not able to stop using at this point. With the hopes that once this pandemic stops and we can get them back to the office, that we can help them through more traditional means.
And so the fentanyl testing strip, they're going to be testing the substance they're using to make sure it doesn't contain fentanyl.
Exactly. And so it's what's called a harm reduction technique out in the substance use world. And for us to be successful, we've got to keep people alive. And so through this pandemic, we've got to make sure that we're providing every resource we can to keep people alive as we kind of navigate through this and hopefully get people connected with us through these more non-traditional means.
Are there costs to the people they're going to be calling in?
No. So we have, through our good funding from the 708 Mental Health Board, as well as some of our other funding streams, we don't want that to become a barrier. We actually have a funded staff member that helps people get insurance or get set up for Medicaid and through the marketplace. So that should not be a barrier at all, and I'd want people to understand that and be aware of that. Reach out to us no matter what your situation is. A lot of people are struggling right now, potentially unemployed and concerned about cost and those kind of things, and we don't want that being a barrier one bit.
With the big change in the world that we're going through, things are shut down. It's probably a pretty good time to take the bull by the horns and go into recovery.
It's definitely a good time. There's a variety of different ways now, more than ever, we can help you. There's challenges and barriers that have always been in place that now we can potentially reduce with some of these different means and different strategies. So I'm hopeful that people understand that we at Chestnut are available for a variety of different reasons, and that for substance use treatment being one of them.
Great. So we'll be posting your information online. Is there a main number or main access point you want to say?
Locally, our phone number is 618-877-4420, and our main website is chestnut.org. You can see a variety of different services we have available through that website, and then someone from our central access team at 877-4420 will be more than happy to explain some of those as well.
Brent, we sure appreciate you coming in today.
Thank you, Mark.
Herb Simmons, you got anything to follow up with?
Yeah, a couple of questions, Brent. Appreciate you coming in, as the chairman said. Could you kind of explain, I need help? How do I go through that process to get that help?
Through Chestnut?
What's that process of that?
There's a variety of ways, like I was mentioning to Mark. We have our 1-618-877-4420 number. That's our main line. Our staff, through our central access team, are trained to provide people with information from a variety of our different platforms. So, we provide a wide variety of behavioral health and primary care services. So, depending on what that individual needs, they can route them to that. For substance use treatment, we do have someone, I don't have that information currently available, I could probably send it to you all later, but we have a dedicated peer recovery specialist who has a work cell phone that he keeps with him that he can be contacted at, and he can be someone that could help navigate through that process. If by chance even Chestnut isn't necessarily somebody they can indicate that they want to get connected with immediately, maybe he can help them understand what 12-step support meetings are available, as well as help them get connected to residential treatment or different options maybe throughout the state if that's what they want to do.
Okay. Another question, if I know somebody that needs help, is there a way that I can provide information and follow-up is done from your agency? Do you get quite a few of that?
We do,
information?
yeah, we do. We also, one of the things I failed to mention, we do have something through our prevention department that can provide some overdose education and Narcan distribution. And, we really like to target family members for that service, just because you really need to be looking at, okay, if somebody were to overdose, who are they using with? Because those particular individuals need to be aware of how to administer that Narcan to help them. So that's available as well, and I would direct them to my 877-4420 number to get connected to that individual, who could set up probably a phone meeting at this point to provide some education, and then we could utilize our curbside delivery for the Narcan distribution. But yeah, all that's available as well, and we can connect people through that. If somebody's just struggling with a mental health issue, we can provide them with an opportunity to come in and talk to us through a Zoom platform at this point to just talk and discuss what's going on with him or her. So if their family member is struggling with someone who may have a substance use disorder, that opportunity is available to him or her as well at this point too.
Well, very good. A lot of good information there, and we'll get all those numbers posted up for you. And anything you've got you want to get to us, we'll get it out there.
I appreciate it.
We appreciate what you do. Thank you very
Thank
much.
you. All right.
Thanks, Brent.
Thank you.
More good information. I think we're covering all aspects of this pandemic, and I think that's what we're here for. The EMA is becoming the information point from all, and we're going to talk about one call that we're getting quite a bit on here in a minute. But first of all, let's talk about what EMA done today. Conference call with the hospitals and EMS systems went good. Still doing a lot of good networking with them, filling their needs. We had a conference call with the legislators this morning, our weekly call. We couldn't do what we're doing without them. And then also, we had 28 agencies pick up the PPE and supplies. And I want to give a shout out to Mr. Herzog, who called today, a gentleman who wants to make a donation. He's going to be dropping that by for our first responders. So you got to do zip codes.
Okay.
You thought I was going to let you forget.
Well, you stole the stage from me. So remember, if your zip code isn't mentioned, it doesn't mean that it doesn't have any COVID positive people in that zip code. It just means that hasn't risen to the level of 5 yet. And also remember that just because you don't have any COVID positives in your zip code, it doesn't mean that you're still not susceptible to getting COVID-19 even if you remain in your zip code, because the spread is everywhere and it's a very contagious virus. So this is done for informational purposes, so you can at least what's going on in your general area. 62201, we remain at 10. 62203, we're at 14. That's an increase of 1. 62204, there are 12, and that number remains constant from yesterday. 62205, there are 15. That is an increase of 1. 62206, there are 39. 62207, there are 23. That's an increase of 1. 62208, there are 25. That number is the same as yesterday, as is 62220 remains 41. 62221, there are 34. 62223, there are 27. That is an increase of 1. 62226, there now are 60, and that number remains constant. 62239, there are 6. 62254, there are 11. 62258, there remain 12. And 62269, there now are 37. That is an increase of 1. So that's the zip codes, Herb.
You got the zip codes done. And as we tell you every day, we have no pleasure in bringing these numbers to you, but that's what we have to do to keep you focused on this. One of the other things I mentioned about the EMA here, we're answering a lot of questions that you send in, and one of them seems to be on the unemployment. They can't get through to the numbers. I wish we had a better way to get you through to them. We will republish those contact numbers again. If we had those answers, we would definitely be giving them to you. We had several calls and messages today.
And Representative Hoffman made the point that getting in online seems to be the best way to get through that process. So make sure you're going online and filling out the application there. He says it seems to work better than the phone line, which is always jammed.
And it actually speeds the process up, is what he told us when he was here the other day. So we'll get that information up on our page for you, and hopefully we can ease some of that stress on you that way there. You heard another new death in the county. We hate reporting them. Unfortunately, we probably will be seeing more of them. The patients in the hospital, the vent count went up. So we'll keep you posted on that, and as we tell you each and every day, be a part of it. Help do your part, because we're all in this together. Stay home and stay alive. We'll be back here tomorrow afternoon at 3:30, and we'll be back shortly with Cindy to translate this into our Spanish communities. Thank you.